Hi, my name is Dr. Josh Hammond, and today we're going to talk about carpal tunnel, which is not only pesky, but it can be painful as well. And the good thing is that you don't have to live with it. Carpal tunnel syndrome is basically a pinched nerve at your wrist. The people that are most likely to have carpal tunnel syndrome are people that have diabetes, thyroid problems, pregnant women, and really anybody as we get older can get it. Carpal tunnel syndrome can be aggravated by repetitive motion, also by vibration, so either jackhammers or motorcycles are common things as well. The symptoms of carpal tunnel are classically numbness in your thumb, index, and long finger, along with clumsiness or dropping things, occasionally weakness, and sometimes pain as well. Carpal tunnel syndrome is diagnosed typically in the office, where we look at kind of the classical physical exam findings that I just mentioned, but we oftentimes will get a confirmatory nerve conduction study just to make sure that you don't have any symptoms coming from your neck or somewhere else in the arm. The best ways to prevent carpal tunnel are, one, by controlling your sugars, especially if you're a diabetic, by limiting your alcohol intake, and also by cutting back as much as you can smoking. The treatments for carpal tunnel, typically we start with a brace that keeps the wrist straight, because whether your wrist bends forward or back, that increases the pressure on that nerve. Injections, sometimes we do, but we typically do that to help confirm a diagnosis if we need to. But other than those non-operative managements, the typical surgical management is going in and releasing a ligament that runs right over that nerve. And we can either do that with a single incision endoscopically or with an incision kind of right over that ligament as well to cut that ligament. Carpal tunnel surgery does not require any hospitalization. It's an outpatient procedure where you would show up in the morning and go home later on, either that afternoon or later morning. It's important to seek treatment for carpal tunnel mainly because once it becomes more and more severe, you can get permanent damage to the nerve. Early on, it's not an issue, but if you don't catch it as it gets to the point where almost having constant numbness, that numbness can become permanent. If you think that you might have carpal tunnel, what you should look for is numbness in your thumb, index, and long finger, and you have to kind of take breaks to shake out that hand to get the feeling back in your hand. The most important thing to remember about carpal tunnel is that it's very common and very easily treatable, and that the surgery is extremely reliable.